And okay, so let's see who we've got coming on. Let's give it a moment. And let's see who we've got so far. Hi, Linda. Hey, Linda, can you hear us okay? Hi, Andre. Hey, Joan. Hey, you guys. If you can give me a thumbs up in the chat, and we're going to go ahead and get started. Okay, here we go. People popping in. We had a lot of requests for a replay on this today. Apparently, a lot of people are stuck at their real jobs and not their health coaching jobs. So if you guys will give me a thumbs up, awesome. Thank you so much, Joan. I appreciate it. And let me go ahead and check this other area over here. Okay, we're good to go. I'm so excited about this topic, you guys. So today I bring you Kat, is it Toups? Am I saying that right?
Perfect.
Okay, Kat Toups, MD, is a functional medicine psychiatrist who specializes in reversing mild cognitive impairment and dementia using a functional medicine approach. She also uses functional medicine in the treatment of psychiatric immune and brain-based disorders. Dr. Toups is a distinguished fellow of the American Psychiatric Association and a certified practitioner by the Institute for Functional Medicine. Dr. Toups was formerly an assistant professor at UC Davis, where she was the inpatient residency training director, and later founded and directed in the Bay Area Research Institute, a clinical trials research center in Lafayette, California for 12 years. After serving as the principal investigator on more than 100 clinical trials for 12 years, wow, including 20 failed trials for Alzheimer's medication, she realized the elusive cure for brain and psychiatric illness was not going to be found in a pill. Dr. Toups has lectured at the IFM Annual Conference on Methylation, Integrative Medicine for Mental Health and Functional Psychiatry, and spoken to many functional medicine groups about functional approaches to reversing dementia. She was featured in the LDN and Lyme video and also on the LDN Research Trust radio show. Dr. Toups is the author of the upcoming book, Dementia Demystified, about how to operationalize a functional medicine approach to reversing dementia and cognitive decline. And she's here today to talk to us about using LDN, low dose naltrexone. All right, so the reason this is such a near and dear topic to me is because when I was in the struggles of trying to figure out what to do about getting a handle on my own autoimmune Hashimoto's, LDN kept kind of crossing my radar. And I would open it up and I'd think, oh, it's a prescription. I'll put that away for later on if I can't do this on my own, right? And then all of a sudden, I couldn't deny how many articles and things I was seeing about LDN. So we're going to use the LDN, abbreviation today for ease's sake. But so I've been on it and taking it for many years now. So I cannot wait to learn more and see if there's something I should be doing differently. So thank you for being with us today.
Oh, thanks for having me.
Yes. So let's start with you telling us exactly what is LDN.
Oh, well, LDN is a fascinating compound. It was discovered in 1975, and it's an opiate antagonist. So it's designed to block the opiate receptors, and it was used for drug addicts, opiate addicts, heroin addicts. So if they wanted to stay clean, they could take this drug, and if they slipped up, they wouldn't get high. Mm-hmm. Well, in the mid-'80s, a brilliant psychiatrist in New York was working with patients in the middle of the AIDS crisis. And he had drug addicts who were, they were struck with AIDS, and he put them on this drug to help their drug addiction. And he discovered that the patients on it didn't die. And in the AIDS crisis in the 80s, we lost everybody. We had no treatments. So he realized, wow, this drug is doing something for their immune system. But the problem is it made them depressed. So when you block your opiate receptors, opiates are our feel-good hormones. And we have no opiates, we're not going to feel good. So he said, well, what if I dilute it? Will it still work? So he kept diluting until he came up with the little tiny dose now that we use as low dose naltrexone. And he found, with that dose, it still worked and gave the benefits. So the way that LDN works for our purposes, because we use it for immune disorders, we use it for cancer, we use it for pain, we use it for psychiatric disorders, we use it for our pets. We can get into some of those indications, but for our purposes, the LDN temporarily blocks the opiate receptor. And that causes our own brain to feel like there's a deficit of opiates, and our brain says, oh my God, we have no opiates today, let's make more. So the brain makes about 6 times more opiates than usual. Then the drug is quickly gone from the receptor, it's a low dose, but you're left with all these beautiful opiates. So the first thing with opiates is they're feel-good hormones. When I first learned about this for immune disorders, I thought, well, what's it going to do for mood disorders? And that is a useful factor for some people. So opiates are feel-good hormones. They help pain. But narcotics are opiates, so we take them for pain. But for the immune system, then, some of the particles that happen with these opiates, there's several different types, mu and kappa and delta opiates, that then bind to our T regulatory immune cells and do things to help the immune system. And it gets deeper than that. There's different anti-inflammatory pathways that affects the NF-kappa B and the toll-like receptors. But really the most important thing is just that these opiates are binding with our T cells and calming down immune disorders.
Okay. So I want to ask, and because I have a lot of things in my head over the years of learning about LDN and taking it, I'm going to have some questions for you, but reminding everyone, absolutely. Put your questions in the Q&A box, you guys. Anything you want to know, go ahead and put it in there. We'll try to cover everything. So my first question is this. Let's go back to naltrexone used for addicts and things like that. We're talking about levels of like 50 milligrams, right? We're talking about a higher dose of naltrexone. So when we talk about low dose naltrexone and how he titrated down and went down to the lower doses, are we talking about 1 milligram to 3 milligrams? Like can you give us a little idea about the differences in doses for addicts and the differences for the immune system?
Yeah, that's an important distinction. So the doses for addiction are between 50 and 200 milligrams usually. Okay. Even some go up to 300 milligrams. So with low dose naltrexone, sometimes people will start at 1 or 1.5 milligrams, but typically the target doses are between 3 to 4.5 milligrams. So it's a huge magnitude of difference,
right?
From the regular one. And one thing that I want to mention, and when I prescribe this and, what I go through with my patients, I always tell them this is an off-label indication for this drug. So the drug is approved for addiction, and we're using it off-label for immune, pain, psych. So for practitioners that are prescribing, it's just some of the legal things that we have to cover to tell people this isn't what the drug was approved for. But it's definitely used much more widely for all of the kind of things that we use in our practices than for drug addiction these days.
Right. Yeah. So interestingly enough, when I first looked into LDN, my first thing was what's in it? Like, how do we compound this thing where it doesn't have the fillers? It's going to undo all the things that I was doing with my food and everything else. We don't want a bunch of fillers. And so looking and finding it back then was a little bit harder than it is today. And there's a pharmacy down in Florida. I'm sure you've heard of Skip's Pharmacy.
Right.
That's the first place I looked to get information about it. And there was a lot, I had to do a lot of digging. How am I going to get this prescription from out of state? How am I going to go about doing this the right way? And I learned that obviously not every pharmacy is the same. And there is a particular compounding process to this. You don't just go out and get anyone to do LDN for you. Can you talk a little bit about why it's so specialized? And also, second part of that question, if you could lead into it, is there a way to go about introducing this into your life? And what is that? Because I know that there's someone that I trust implicitly, and she has a very big, she's got a big opinion on the method of this.
Yeah, well, there's differences on that. So the filler first. The joy of compounding pharmacies is that they can access different types of fillers. And there's no one filler that will agree with everybody. We're all working with patients that are very sensitive, that have immune problems. The most widely accepted filler and the most used is Avicel. And I can't remember the specifics of, why, but definitely that is what I had learned as, okay, you want to start with Avicel. And certainly Skips does that. I use Belmar Pharmacy in Colorado. There's, as you mentioned now, lots of pharmacies that are compounding this. Both Skips and Belmar in Colorado will ship all over the country.
Yep.
So yes, it's much easier to get. There's local compounding pharmacies that make it, but it's true that you should ask about their filler. And I mean, I've had a few patients, and I've used this in hundreds of patients, but I've had a few that don't tolerate LDN. And, there's always somebody that is exquisitely sensitive to something. And so it is a notion, if somebody is not tolerating it, that perhaps you might want to try a different filler and see if that's the case. But a good compounding pharmacy is going to be using one filler, not a bunch of stuff like you would get in a pharmaceutical drug. Okay, what was the second question was, how do you introduce it and how do you use it? Okay, well, there's a lot of differences in that. When I first started using it, I was much more conservative, and I would, start at 1.5 milligrams for a month, and then I'd go to 3 milligrams and go up very slowly. As I got more comfort with the very good tolerability and safety profile, I actually go up more quickly than that. So as I said, the target dose is going to be between 3 and 4.5 milligrams for most people. And typically it's been 4.5, but some people will go to 3, and that's just our sweet spot, and they feel great, and you can leave it there. So what I do these days, just for ease of ordering, prescribing, more cost effectiveness, I prescribe a 4.5 milligram strength. I have my patients start with a half dose, and they're easy to break in half even from Belmar, or you can use a pill cutter. And I have them take that for a week. And the reason that because some people, okay, when you have cancer and you're going down, you want to get this in as quickly as possible. You don't want to take 3 months to get to the target dose. And,
right.
So with what happens is, one of the primary side effects that we do see is that about maybe 40% of people get wild dreams with the LDN. And that usually lasts about a week. And it will settle down for most people. When I started LDN, I had those dreams.
Me too.
And they're just trippy. I tell people they're not nightmares. They're just really interesting. And you wake up and you think, oh, wow, that was a strange night. But I want people to get used to that if they're going to have that side effect. And so I'll typically just have people start with a half dose for a week and then go up to a whole dose. Sometimes it's just an intuition thing, like this person may only need 3, and I'm going to give them a 3 milligram and have them start with half and then go up to 3. But, it is all over the board. People use what they're comfortable with. There's no right or wrong way. You always have to individualize for that patient. How much do they need this quickly? What is their sensitivity to side effects? But let's stay with the side effects for a second. So that's the most common side effect we see, is with the dreaming. And it usually settles down after a week, and people might see it occasionally. Typically for immune disorders, we always gave it in the nighttime. And now that's changing quite a bit. We'll talk maybe some about the psychiatric disorders and how we use it differently, but it definitely will work in the daytime, even for immune disorders. So I just tell people, well, take it at night, but if you have any problems with the dreams waking you up, just shift it to the morning. So a few people will say they have insomnia because of those dreams. The dreams are just, waking them up. So that's the most common thing we see, and not everybody gets it, and it's not predictive of the response. So if you don't get the weird dreams, it doesn't mean it's not going to help you.
Right. Yeah, if I could say, when I started LDN, I did have the nightmares. They were...
Yours were nightmares?
Oh my gosh. I dream, I can have probably 5 dreams in a 2-minute nap. And they're very, very clear, and it's like I'm them. And my therapist is always like, I just want to evaluate your dreams someday because they're so crazy. Well, when I started LDN, the nightmare, the first, it was 3 nights in a row, but then they went away completely, but they were so real. It was like I was in a slasher movie. I woke up absolutely scared out of my wits. Oh, yeah. I was sweating. My heart was pounding. My cortisol was up. I turned the light on like I'd just been in a movie. It was that scary. And then they were gone. And I was like, oh, thank God that's over. Then I took a break from it because, and I'll talk to you about that, why I did in a minute, because you can probably explain this for me. When I restarted it, I didn't have that happen. So I don't know, but it was the same dose, same process, and I didn't have the dreams at that time. But I was nervous about it, I will tell you, because I was like, oh my Lord, that was the scariest thing I've had. I mean, yeah, it almost made me want to quit. But I didn't. Wow. I stuck it out. Yeah.
Wow. Yeah. And so, there's always an exception to every rule. And here I'm telling people, no, they're not nightmares, but you had nightmares.
Yeah, but not everyone does. Like my mom didn't, and my friend didn't. And yeah, maybe I'm just special like that.
You are.
Yeah. Okay. So, all right. So let's go back to the timing of the dosage. So do people get sleepy on this? And why was it prescribed at night to begin with?
I don't know why it was prescribed at night to begin with. That's a good question. And that was just like in traditional medicine, we have dogma, and functional medicine, we have dogma too. And there's not always, data for why we do things. So I just learned, give it at night. And as far as does it make people sleepy, a few people get sleepy on this. It's not common at all, but a very few people, you know, when they're taking it in the daytime will feel sleepy. If you take it at night, most people won't have a carryover sleepiness in the day. But again, there are some people that can be exquisitely sensitive. We're giving it to people with immune problems and chemical sensitivity. And so you have to expect anything with our population. But very few people get sedated with it. Typically, it's not sedating. And, you know, so, you know, with regard to the timing, so at the LDN conference a couple of years ago, 2 different psychologists presented data on using it for PTSD. And they were using it for veterans with PTSD. And they said, well, instead of giving it at night, let's try giving it in the day so that we can maybe get those higher endorphin levels in the daytime. So they gave half of the dose in the morning and half in the late afternoon. And they both found great effects with this population. So for people who might want to have, you know, a sense of calm and well-being in the daytime, they can take it in the daytime instead of the nighttime. Now, I've tried that a few times myself, and when I take it in the morning, I just feel peaceful. I feel like internally quiet, maybe less type A, you know, and not sedated, just it's an interesting calm, but it's not like a drugged sedation. And for me, I'm just so habituated to taking it at night. I never stayed with it because I'm used to the nighttime. But but definitely for people that would like to have more relief from anxiety or depression or reactivity, the timing is negotiable. They can take it whenever they want. Right. And what I tell people, if they're gonna split the dose in the day, like try to do half in the morning and half in the afternoon, it's hard to remember to take things in the afternoon. And so I tell them, okay, if you forget, just take that other half at night. You know, it's pretty forgiving. You know, you don't have to keep like a super steady, tight level for this to work.
Right. Now, I thought I had heard, and this is, I mean, I don't remember, it's been so long, but I thought I had read or heard that something about it being more effective at night due to when opiates are
produced.
So maybe that was the reasoning behind that?
Yeah, I think so. I think, you know, like many of our hormones, there's a cyclicity to when they're made. And so I think that we do make a lot of them while we sleep. And so that's why they chose the night. I think you're correct. But clearly, we're still getting those effects by using it in the daytime as well.
Right. So when you said you felt that calm over you, kind of like one of those weighted blankets people sleep with, is that what it was more like? Just kind of like a calm feeling that made you just kind of settle in?
Not even that heavy.
Really?
It was just, it's not. It was just, I just felt peaceful.
Okay.
Just less, you know, reactive, I guess. And
I'm a AAA personality too. So maybe that's something
you'll have to try it.
Okay. So I want to talk about, you said something about cutting the dose. Now I've only ever seen LDN given in capsules. So do they now compound those in tablets or is that?
Yeah, so Belmar Pharmacy makes it in little tiny tablets, and they're very easy to break even without a pill cutter. So some people make it in capsules and some in tablets.
Okay. All right, so let's go into the topic of the conditions. And maybe you can put some more clarity on how it affects different conditions. Can we start with the immune system? Because I know so many people are dealing with autoimmunity today, and then kind of move into the behavioral area as well. Yeah.
So to me, it's a no-brainer to try LDN with any kind of immune disorder. I mean, we've had efficacy in anything you can imagine.
Yep.
And you mentioned Hashimoto's. I mean, Hashimoto's, you know, it was when Dr. Bahari first was using this with the addicts, his first thing after he realized the immune things, he said, well, I'm going to use it with multiple sclerosis. And with MS, you have a kind of relapsing remitting course, and then you can go into a very acute chronic course. And so he gave it to people that had shifted into this more severe picture, and they just stopped progressing. Then he said, okay, well, what about Parkinson's? He gave it to Parkinson's. They stopped progressing. Now, one thing that's important to note is that it doesn't cure the underlying disease. It's just, you know, it's supporting the immune system to cure the disease. And some people that will be enough, but most people are going to need the whole general functional approach of what was causing the autoimmunity in the first place.
Right.
So then from that point out, it started trickling into using for other immune disorders. So Hashimoto's is one that should be a special consideration to talk about, because sometimes with Hashimoto's, it can improve the thyroid function so rapidly that if somebody's on medication, they'll find that, oh my God, I'm on too much medication. Now, you know, when you're hyperthyroid or getting too much thyroid medicine, you'll be jittery, your heart will race, you could sweat more and feel anxious. So when I use it for Hashimoto's, I let people know that if they have any of those symptoms, I order their thyroid labs, I give it to them. I say, if you start to feel like you're on too much medicine all of a sudden, go pull your thyroid labs quickly and let me know, because it will work so quickly for some people with Hashi's. That's a really fun situation. I gave it to one of my sisters who had developed Hashi's, and I knew she didn't have it. I'd been working with her for a while, and then suddenly she did. And so I said, well, let's put you on this LDN. And she called me a week or two later, and she said, oh my God, this stuff immediately started to clear my psoriasis. Well, I had forgotten, I hadn't seen her in person in a while. I forgot that she had psoriasis. And so, you know, I didn't say this is going to help your psoriasis, but it sure did. And she had the plaque psoriasis on her elbows and knees. It's all gone now. She had that for years, and the LDN cleared it up for her.
That's amazing. Yeah, I think I wrote a thyroid guide, just kind of a layman's thyroid guide. And I think I mentioned in there about, you know, the fact that you can become hyperthyroid, and, you know, to absolutely get with your doctor about how to kind of cut your doses and start working with your doctor immediately on that. Because, and let's go back to what I said earlier. I told you I was going to let you know where I took the break from LDN was.
Yeah.
At one point, this was years ago, I got strep throat, and I remember the strep cleared up immediately. I felt my throat didn't hurt. Like 24 hours later, I felt pretty darn good, but I could not break this fever. It was 103, 104, 103, 104. I was sweating through my clothes all day. At night. It was awful. So I stayed hydrated, and I finally went into the doctor after day 3 of this. And I said, I don't know what's going on. He's like, we're going to test you for mono. Something's happening here. Negative. I said, I feel great. I just can't break the fever. You know, I went off the LDN. I stopped taking everything I was taking at the time. And taking out the LDN, all of a sudden, literally 3 hours later, fever was normal. It was like it was overstimulating my immune system or something. I don't know, but and I went back on everything else, started the LDN, got the fever back again. So I don't know if it just was working too well for me. I don't know what was happening there, but it was absolutely the LDN. So I took a break from it because I was like, this is not normal.
Yeah.
Yeah, but then went back on it, you know, probably about a year later or so. So I think it was really powerful. I was taking 3.5 milligrams at the time. Yeah, crazy. Okay, yeah. So let's lead into, let's talk a little bit about, I want to talk about MS because, you know, we have our mayor here locally, well, the one we had before the election, she has MS. And then, of course, we know Terry Walls has MS. Do you know if Terry Walls uses LDN? Does she use that in her protocol? Surely someone's told her about it.
Oh, I know Terry knows about it. But I'm trying to remember, I saw her recently, but, you know, didn't talk about what she was taking. So I don't know.
Just curious because it is so, I mean, I've heard it's just so powerful for, you know, for reducing the symptoms and for supporting the immune system for MS. I'm surprised, and maybe you can answer this, why we haven't heard more about this in the mainstream functional or conventional medical world.
Well, I think it's getting pretty well known in the functional world. It's just that it's not a pharmaceutical drug with a big profit margin. And of course, now pharma is getting involved. I mean, they've made some drug where they've combined it with Wellbutrin for weight loss. I don't know much. I haven't used it. Actually, somebody had just sent in an application that wanted to see me to try LDN for weight control. And I personally have never used it for that indication, but pharma's looking at it, right? Because it works. And of course, you know, our hope is that they don't get their claws into it so that we don't, you know, lose our ability to get it inexpensively from the compounding pharmacies. So it's to me, as I said, a no-brainer. If you have an immune disorder, you ought to try this. You know, it's got a great safety profile. It's very well tolerated. It's very inexpensive. You know, where I get it from Belmar Pharmacy, you can get a 90-day supply for $52 with free shipping. So that's
Wow.
like $17 a month. That's going to be less than your copay for some of the generic drugs, right?
Right.
So it, you
Absolutely.
know, it's the price of a supplement. Patient might as well try it. But let me say one thing about the supplement. I always warn my patients, this is a medication and it's not a supplement. And
Right.
when you go to the doctor, you need to let them know you're on it.
Right.
So it's blocking the opiates, and say you got in a wreck and you were brought to the emergency room and they gave you narcotics. The narcotics don't work when you've taken the LDN because it's blocking the receptors. It's temporary and they will work after a certain number of hours. But a good friend of mine who's a psychiatrist, functional psychiatrist, was taking it, and she started a treatment for parasites. And it made her vomit violently all night, terrible pain. She lives alone. She had to call the ambulance, go to the emergency room. And she said, okay, they gave me some morphine and it didn't work. And then they gave me Dilaudid, which is a really powerful narcotic, and it didn't work. And she said, oh my God, Kat, they thought I was a drug addict. And then she finally remembered to tell them, oh my God, I took my LDN tonight at bedtime.
Yeah.
So, you know, it's, so I tell people, if you're given narcotics, it won't hurt you. They just won't work very well. She told me by the wee hours of the morning, she started to have some pain relief. So it was gone enough out of her system after some number of hours. But it's very important. So the only drug interaction with LDN is narcotics. And so if you're going to have a surgery for anesthesia with surgery, they'll use narcotics for the pain control. They don't use it for colonoscopy usually. So when I had my last colonoscopy, I asked, you know, my doctor, do I need to stop this? No, it's a light anesthesia, and I didn't need to, but that's going to be the doctor's decision. So anytime you have a surgical procedure, the drug is probably mostly out of your system in one day.
Yeah.
But I tell people, you know, 3 days, 5 days, 7 days, you know, I mean, I think 3 days is probably pretty safe, but some people say 7 days to be uber safe.
Yeah.
You know, but as I said, from my friend, she was able to have effects with the narcotics, you know, 8 hours later. And I have discussed that when I was first learning about LDN. And I would mention this to the listeners here. I mean, there's some great Facebook groups about LDN. So I went to the Facebook groups and I joined and I read their stories, and I'd sometimes message people. And one woman had a central pain syndrome, and she was on high doses of narcotics for years. And she went on LDN and was able to mostly get off those narcotics. So she took the LDN at night, and then she woke up with more pain control. And she said, sometimes I have to take some morphine in the afternoon, but it works for me by the afternoon. So, you know, it's just interesting to kind of see that it probably is mostly out of your system in a day or two. The half-life is short.
Yeah.
But just to be careful, you know, I always put it in the notes, and, you know, even put it on my prescriptions, you know, stop this prior to anything that needs anesthesia.
Yeah.
And it would
Go ahead.
I was going to say the same thing, like say sometimes people will have a dental procedure where they're going to be on codeine. So if you're going to have any kind of procedure, or, you know, some skin cancer thing or something where that, you know, you're going to be on pain medicine, then just stop it for a couple of days ahead of time. It's very easy to stop and start, you know, as you discovered it, you know, gets out of your system quickly, but it's not addicting. You don't have any withdrawal, and you can just restart it as needed.
Yeah. So I'm glad you brought that up, because I had the word written down here, which if you see me looking down, I take notes and stuff, but I had written the word surgery on there because I wanted to bring that up, because when I had shoulder surgery back in 2015, I had absolutely nothing was working for me. I got all of the pain medications, rotator cuff surgery, and shoulder surgery is one of the most painful things you can experience.
I've had it.
The rotator, the bicep, the loss of cartilage. Oh my goodness. Well, by the fourth prescription that wasn't working, I was on Dilaudid. 4 prescriptions. I had enough drugs that, you know, that I could have made some cash off that, right? None of it worked. And I never put the connection together until afterwards. I ended up taking Aleve, which Aleve actually helped better than anything.
Right.
So when I had my dental work done this past February, I remembered that. I thought, I'm going to stop taking the LDN for, you know, I think it was 48 hours prior to the surgery or whatever. Still, though, the medication didn't do the job that it should have done. I just don't take pain medication very well. Aleve seems to work best. But I'm glad you brought that up, because I ended up buying a bracelet back in the day with the LDN on it, because if something happened to you, you know, and they have to give you that pain medication, and you're not able to tell them you're taking that, for some people that would be a huge thing to wake up in that much pain, you know?
Yeah. Now, one thing to know, and tramadol is an atypical narcotic, and it has a different mechanism of action. So tramadol apparently can work around the LDN. And interestingly, when I did my rotator cuff surgery years ago, I don't like narcotics. They make me nauseous. I didn't want to take them. And back then, tramadol was only available as an injection. And I said, give me tramadol injections. My poor husband had to give me the shots. But tramadol is the one thing within the narcotic family that, say you've taken it and you suddenly needed something, tramadol can work.
Yeah. Yeah. Oh my goodness. Okay. And I see the questions coming in, you guys, and we're going to get to them in just a minute, but let's continue into the psychiatric uses for this and how that works. And if you can touch on some of the more common things that people deal with, like bipolar disorder or depression, anxiety, and how it might work for those things, that would be great.
Well, let me say that the deeper I get into functional psychiatry, the more I've come to learn that I'm dealing with immunity. You know, now we can test brain antibodies. A lot of my bipolar patients have brain antibodies. The notion of children with pandas, well, my adults with, you know, bipolar and psychosis and OCD often are having immune disorders and infections that are triggering their immune system. So just from the straight immune perspective of trying it with psychiatric disorders, it makes sense. My first notion, I always wondered when I learned about it, well, what is this going to do for depression, anxiety? And I had a patient who was having immune problems, and I gave it to her, and she came back 5 weeks later. And she told me this horrific story. They'd had this big asbestos leak in her home. And she had 2 little toddlers. They were all exposed to asbestos. They had to move out, very stressful. And I'm getting super stressed, you know, feeling all of that. And then she gets this big smile on her face and she says, but my depression and my anxiety are gone. I'm like, they're gone? She said, yes, it's the LDN. Since I've been taking it, it just resolved those things. So here she coped with this horrible stress, and she had pre-existing depression and anxiety.
Wow.
So definitely, you know, something with those endorphins. And I would imagine for some people beyond that, it's actually some immune effects as well that we're seeing. So I mentioned the PTSD. I mean, endorphins are feel-good hormones, and we have, you know, many of these psychiatric conditions have a deficit of dopamine, a deficit of, you know, serotonin, feel-good. So anything we can do to enhance that in a safe way is useful. So I have sometimes, you know, tried it with people where it was a primary psychiatric condition and not obviously an immune condition. And, you know, it's not my go-to. I'm still trying to remove the root causes, and but it's definitely, again, an easy thing to use and try, another tool in our toolkit.
Right. And so I want to just make sure that I make this point because, you know, we've got mainly, you know, 95% health coaches here, but sometimes this video gets, you know, shared across the waves. And one thing I want to make sure and make a point of is that LDN is not a fix-all. It's not going to cure anything, you guys. We have to remember when we're working with our clients that if we bring this up as a resource, and again, how I teach is that they share the information with their clients, let their clients take it to the doctor and make a decision with the doctor. We don't recommend anything as a diagnosis, dosing, whatever. But without, you know, removing the environmental triggers and the emotional triggers and the traumas and the foods that, and getting enough sleep and moving our bodies in a healthy way, you might as well not bother with things like this because you're not fixing the underlying reason these things are happening in the first place. So let's not forget. I teach on 7 foundations of health that we approach all of those things. And this is just that bonus that comes in and supports your clients while they're going through the process of adapting their body to, you know, living in a better way. Right.
Yeah.
Yeah. So with that said, I want to go back for a second because recently someone asked me to bring a pandas expert on. Mm-hmm. And I would like to know, what do you know about pandas? What is it? And how does LDN fit into that?
Yeah. Well, that's a big, long topic, but you know, pandas and PANS are, you know, typically in children, it's diagnosed in children. They have acute onset of tics and then major behavioral problems and OCD. And so the key there is it's an acute onset. triggered by an infection is what
Okay.
we know now. And then many of these, especially viruses, easily go into our brain. In the world of dementia that I'm working in these days, we're finding so much of dementia is affected by infections. And that's one of my treatment targets, is finding these infections. So with the kids, you get a scenario like that. And if you're not going to do a functional approach, you're relegating that child to a lifetime of psychiatric medication and disability. So it's so important to, as you take, we always start with, our timeline, right? Go back to the beginning. When did what happen? And put things together for our clues to know how to help this particular patient. So I had a case that I took on. I'm not trained with children. This was a 12-year-old. And the mother said, please, could you help me with this case? Well, her uncle was, somebody in the IFM movement that I have a debt of gratitude to. And I said, okay, let me do the workup and let's see what we find. And then if we turn something up, I'll send you to someone. So I did all the workup because this child had tics and OCD. And I tested everything, and typically, most commonly, it's caused by a strep infection. But in his case, there was no strep antibodies. What I turned up was he had active mycoplasma. And then I get the history. The mother's eyes get wide, and she said, oh my God, he had walking pneumonia. We couldn't get rid of it. He had several courses of treatment. And shortly thereafter, that's when the tics started. And then the OCD started. So that was a case of PANDAS. That infection crossed his blood-brain barrier, ignited his brain with all those cytokines and that whole big inflammatory response and autoimmune response, the immune system kicking in, trying to fight those infections in his brain. So I did send him to a PANDAS expert that I know, and I've gotten feedback recently that he's doing really, really well. So it's so important with any psychiatric disorder. We've got to look for root causes and not just say, oh, you have bipolar, you have schizophrenia. I have another young man in his early 20s. He had to drop out of UC Berkeley, a physics student, brilliant young man. And he had 3 hospitalizations for manic psychosis. And we did somebody had done this actually before he came to see me, a Cunningham panel, which is a brain antibody panel, and every antibody was positive. That told me immediately, I'm dealing with, infections in this brain here. And so, he had another hospitalization, and they, put him on higher doses of meds. And he said, I can't think, I can't function. The doctor said, you know what, you'll get used to that. Everyone with bipolar has brain fog, and you'll just get used to it. And it's like, no, we don't want to just have people just manage their disorders, right? We want to keep looking for what caused that disorder, because then we have, treatment targets and we can resolve these disorders.
Right.
So the whole PANDAS thing, it does apply to adults as well. So definitely, and it's a big driver. Infections are a big driver of dementia as well.
Yeah. You triggered a book that I read one time many years ago called Brain on Fire. I don't know. Have you heard of that book? That poor girl. And there was a movie. I think a movie was done on Netflix or something. But that book, reading that book literally gave me anxiety for her. Just how out of control that was. Yeah. Do you remember what her diagnosis was? I mean, this is not on the talk of LDN, but I'm just curious. Do you remember what that was?
So she had antibodies to the NMDA receptor. And you can now test. Used to be you could only test for that at Mayo Clinic, and it was expensive, send out tests, but Quest has it now.
Okay.
So I do, it's part of my workup when I have, psychiatric patients that I'm looking at all the factors. I do test for those antibodies. I haven't found any yet, but but now we have, the Cunningham panel for brain antibodies is $700 or $800. It's not covered by insurance for most people. It's pretty pricey. But then Cyrix Labs came out with a brain antibody panel, and theirs is still pretty pricey in the $400 to $500 range. But then Vibrant America has a lower cost one. They had one that was $149, and then they've just expanded it with more antibodies for $300. So, I think especially at that $149 price point, I tell my patients, I try not to order unnecessary tests. I'm so cognizant of the cost of, of what we're doing. But I say, this is a bit of a fishing expedition. It may not change my treatment, but if we find stuff here, it's going to, guide me in what I'm doing. And so if we find brain antibodies, we got immunity, that taking it back to our LDN, this would be a good situation to try LDN support.
Absolutely. It's just like investigating the gut. You got to do, sometimes you have to have that piece of those labs in black and white for the checklist to figure out what's happening, for sure.
Yeah.
Okay. So we've got about 20 minutes left. So let's go to the questions here, and I'll go ahead and read them. And so Natalia's asking, since you mentioned, and we've already kind of covered the fillers and all that stuff, but this may be redundant, but since you mentioned it's a medication, how does it affect the microbiome, especially as a concern with autoimmunity?
I don't know that there's any direct answer to that, and we certainly don't see any adverse effects on the microbiome. And that brings me to there's so many indications. I'm looking at my list to remember to tell you some of them. So one of the indications we use LDN for is SIBO. And so, I mean, in that case, perhaps it's having a positive effect. It's considered a pro-motility agent. And we think now with IBS, the thinking is that IBS is an immune disorder, that you get an infection, you might clear the infection, but your immune system is still reacting, and it can affect the migratory motor complexes in the lining of the gut. That affects your peristalsis. And so if those aren't functioning properly, you can have constipation, diarrhea, or both. And so LDN has long been used in the SIBO community as a prokinetic, but also for the immune support, because, SIBO probably is a sequelae of something infectious that's triggered the immune system. So it's a good question about the microbiome, but if it's doing anything, it's having a beneficial effect by moving the waste out of the gut in a more concerted manner.
Yeah, I would agree. She also asked, have you used it for insomnia? If so, what is the dosage usually, and when would you take it?
I have never used it for insomnia. And I guess if your insomnia is somehow related to pain, immune, or maybe even, psychiatric conditions, but I haven't used that as a primary indication for insomnia.
Right.
When would you take it?
I take mine about 30 minutes before you go to bed usually.
Yeah, I take mine whenever I'm going to bed, brushing my teeth. It does, once you get past the dreams, it doesn't seem to wake you up.
No.
So I guess if you're thinking that would be your biggest load of endorphins, shortly after you take it, then take it at bedtime.
Yeah. And let's remember though, where's the insomnia coming from? Again, it's just a support system. Find out why the insomnia is occurring, and go after that. Right. Yeah.
Right.
Yeah. So Carol's asking, have you personally used this for Parkinson's?
Let me think. Parkinson's, yes. I've had a couple of Parkinson's patients on it, and again, as I mentioned, it can really stop the symptoms, but you still have to keep looking for what's driving that Parkinson's. And with Parkinson's, it's often turning out to be toxins. That's a huge factor, in the Parkinson's population.
Okay. What kind of toxins are we talking about? Are we talking about Roundup? Are we talking about glyphosate? I mean, what are we, what have you seen?
Yeah. Any kind of chemical toxins, including vaccines. I had a young cousin who was a military officer, and he got Parkinson's in his 30s. And, he was overseas, and I know he was slammed with vaccines, and they have immune disorders in his family. And I just couldn't help but think that, we know that, they're putting in excipients on purpose in those vaccines for our immune system to react. So it can be, any kind of chemical, mercury from your mouth, the fluoride in your water, it's cumulative. And the people that get immune disorders, especially those by toxins, they don't detoxify well. Some of us have genes that, we're just not going to detoxify, and we're going to be the canary in the coal mine that gets the illness. But our world, of course, is becoming so toxic. So it's very easy to, I love the Great Plains Labs tox test. It's $219. It's an extra $100 if you add the Roundup. And, I know it's important to know about the Roundup, but what I was finding when I was testing that is everybody's positive with Roundup. Everybody. I had been eating organic food for 20 years, and I had eaten religiously organic since 2009 when I got very sick. And I was in the yellow zone still of the Roundup, and so was my family. But so it's so ubiquitous. Even if you're religiously organic, you're still getting it.
Yeah. And what's your best, and staying with that theme though, because this is, it's so helpful. What is the best way to detox, that out of your system? What have you found to be the most effective method?
Yeah, sweating. The best data for
Sweating?
getting rid of toxins is sweating. It's our own natural mechanism to detoxify, right? It's been used in all the native cultures, sweat lodges, and, purification ceremonies where you sweat. So any kind of sweating, what's his name? There's a great researcher out of Toronto, an MD PhD, who showed us all the data on this. This is his area of research. He spoke at the Integrative Medicine for Mental Health 2 years ago. And he said, it doesn't matter if it's a near infrared sauna or a far infrared or hot yoga, whatever it is. If you sweat, you're going to be releasing the toxins. But here's the caveat. When you sweat, you got to wipe it off. So you can't just sweat and then reabsorb your toxins. So as you're sweating, you want to be wiping it off, and you want to jump in the shower after, a sauna session or a hot yoga session and get those toxins off of your skin before they come back in again.
Yeah.
But that's the best data. Obviously you can, take supplements to support, detox, and take NAC and take glutathione and, take binders, but sweating is the best.
Yeah. I think that's one reason why I feel so great in the summertime. And when winter rolls around, my thyroid slows down a little bit. My body doesn't feel as great because I work out in a gym that doesn't have any air conditioning. It's literally a big metal box. And I sweat so much that everything I wear, you can wring it out in the summertime. Yeah, down here in Tennessee, we can feel some serious heat. And I think that's one reason I'm drawn to that weather, is to just get hot and sweaty because I feel so much better. So good to know. All right. Anushka's asking, it's also used with psoriasis. Is it available in Belgium?
I know it's available in the UK. So what I would say is go to, there's a website, ldnresearchtrust.org. And that's a very excellent and helpful group. And they're the ones that sponsor the LDN Research Conference. And the woman who runs that is based out of the UK. And so, Belgium is nearby. There's probably resources on there. But I think it's probably easily available these days in Europe. I mean, it wasn't, 6 or 7 years ago, but it probably is now. And yes, psoriasis, it's super great for psoriasis. Among other immune stuff, I started taking it for general immune support, and I had psoriasis, and for me, it's mostly on my scalp, and I would have to use topical steroids, and it would itch, and within days of taking it, I haven't used topical steroids on my scalp in years now. It's just started to clear for me almost immediately, as it did for my sister and other patients. Yeah, so psoriasis.
That's pretty incredible. I wonder why psoriasis has such a great, maybe it's because maybe you see it, maybe it's a visible thing, so we see how quickly it works as opposed to some of the things that are going on inside of us. We don't get a clear view, a clear picture of how well it's working, but it could be working just as well.
Right.
Yeah.
Speaking of that, I want to, I just have some notes of a patient that came back yesterday that I wanted to mention for her, how fast it worked. Because some of these stories of the patients are just so empowering, and we need, I think one of these days I'll write up all my cases, but I saw a woman back for the third time. She's a 45-year-old surgical nurse, and she has very bad chronic fatigue and fibromyalgia. She's had it for years. She told me she's had fatigue since childhood. She had an emotionally abusive mother, and then she married someone who was emotionally abusive, who killed himself. And as soon as that happened, her fibromyalgia pain started. So you've probably discussed this, but the triggers with trauma and, immune disorders. And she said, it was hard to get through her days. Her eyes hurt, her eyes burned. She was chemically sensitive. She just, had no energy, and she was in pain all the time, and, pushing herself to get through work. So I gave her a 4.5 milligram strength. I said, start for half for a week. And, I told her the benefits of AM and PM, and she chose AM. So she came back in 1 month. She said, LDN was helpful after 1 day.
Wow.
She said, it's been a month and my pain is so much better. My spasms are better. They're still there, but they're better. I'm less exhausted at the end of the day. I'm at least 60% better. We did a fatigue severity scale. It was 6.1. It went down to 4.4. She said, it's not as effective for my fatigue as it is for the pain. And she said, as far as side effects, she said, I felt like I had the flu for the first couple of days and then it went away. And that is maybe the second most common side effect. It's reported with fibromyalgia, that somehow it can maybe in the beginning intensify and you just feel a little flu-like, but it does pass. So she came yesterday for the 2-month follow-up. And she again said, it helped me almost immediately with my back spasms. And now it's helped the debilitating fatigue. She said, I used to spend all weekend and all my nights in bed. She said, this is the kicker, this brings tears to my eyes. She goes, I was able to travel for the first time in years. She went to Spain. She walked the road to Santiago. I mean, this is a woman 2 months before with severe pain and severe fatigue. And she said, now I'm, even getting back into exercising. And, this is like 2 months on LDN. And I'm not working with her as a functional patient. My practice has been closed for a long time to new patients, but I still will see people for LDN because it's a limited, appointment. And so, she's doing she's following a clean diet. She's doing whatever else she's doing, but this was our only change. And it's just such a beautiful story about this little intervention and a big payoff.
Yes, that's so powerful. And, I think sometimes we underestimate, going back to the trauma part, I'm huge on addressing trauma. Everything lately, probably for the past year, I've just gone, experiencing my own traumas and making sure that I go back and find the original wound from childhood, that we have to go back and back and back. And, I think that we underestimate how closely physical symptoms are related to those emotional disturbances and problems that we have in our bodies.
Yeah.
And to be able to support us like that, I mean, just to even have something like that from the outside to support you while you're working through the mental and emotional parts of it can be so powerful for people.
Right.
Yeah.
Right.
I mean, gosh, the way that we get, the fight or flight and we get so rigid and when something traumatic happens, that's got to have an effect on us physically. 100%.
Oh, I mean, you could definitely learn where you put those emotions in your body over time. I know.
Yes. I'm very familiar with where mine go, unfortunately. Yes. But I'm chipping away at them, I'm a big believer in therapy. Just get at it and let's get on with our lives. So Andre asked, what doses of LDN would you recommend for a slender 12-year-old? Just a suggestion. We know you're not diagnosing or prescribing, but a 12-year-old with PANDAS, what would be a common dosage for that?
Well, again, I don't treat children, so I'm not trained in those doses. When a child has gone through, it's not a weight-based thing. So when a child has gone through puberty, then their liver and kidneys are probably going to work as, pretty similar to adults. So past puberty, the doses are not that dissimilar. 12-year-old, they may or may not have gone through puberty. I would think probably working up maybe to a 3 milligram dose, start with 1.5, like get a 3, break it in half, work up something like that, I would say.
Yeah. Okay. And that follows up where we just said about the liver. You said, are there any negative effects on the liver with this?
Right. So not with LDN. And the one thing I ask, if I'm seeing a patient only for LDN, I ask them to bring in a chemistry panel. I say, I want to see your liver and kidney test. It's not even like really necessary, but the full dose naltrexone can have some effects on the liver. We don't see any at all with the low dose naltrexone, but it's just to cover my butt, from a med legal perspective that I've, determined that their liver and kidneys are functioning optimally. There's not really any recommendations to change the doses. I mean, if somebody's, in liver failure, then their liver's not going to break down drugs and, it's going to, you might want to dose a little lower, but, even if they're in mild, if they have fatty liver, you don't need to adjust the dose for that.
Okay. Anushka says, I helped it out with, I don't know what that means, with Dead Sea products and not eating gluten. And, psoriasis. I think we're going back to the psoriasis thing. Yeah. Then she said, I could cure my psoriasis with it, but when I get very stressed, the itching starts to get in my head. Still missing this last help. I'll look it up in Belgium. Thank you so much. Yes.
Oh, great.
Yeah. Peggy's saying EBV. I know that's Epstein-Barr virus, but what is your question, Peggy? Are you asking if it's effective on viruses like EBV? Or I'm pretty sure that's probably what it just says.
It's
EBV.
definitely worth trying for viruses. Again, the viruses are suppressing the immune system. EBV can wreak havoc on your immune system. Definitely worth trying with EBV.
Yeah.
We should talk about cancer too.
Yeah, let's do that. Yeah, we can go a little bit over, but let's definitely touch on the cancer. So let's talk about that. Go ahead and tell us how effective it is. How does it work?
Yeah, cancer is the ultimate failure of the immune system. So we all have cancerous cells that arise every day, and our immune system, if it's functioning optimally, should find them, get rid of them, right? So if the immune system is not working well, then the cancer cells start to grow out of control. So if you think of cancer as an immune disorder, which it is, then LDN is a useful treatment for that. So there's been some studies done, and there's a guy in New Mexico, Bert Berkson. I heard him speak once at A4M, and he presented some of his research, and he's published on this topic. And he was using LDN 4.5 milligrams, combining it with IV lipoic acid. And he felt like the synergy between those two. He told us of a woman whose breast was completely eaten up with cancer. And they started their treatment, and one day she came to clinic, and they said all of a sudden her breast was bleeding and something had popped out of it. And then it completely healed. And, you know, when your breast is all eaten up, I mean, that's not a good prognosis. But the woman completely showed us pictures. It was pretty dramatic, you know. So in my mind, I think anybody who has cancer or who has had cancer, because if you've had cancer, your immune system didn't work. Now, hopefully, if you've had cancer, you're going to be working with great functional health coaches and changing your life so it doesn't come back, right? That's should be for everyone, and it's a problem. People say, "Oh, I'm cured. I'll go back to my diet," you know. But definitely in the cancer realm, to me, it's another no-brainer. That's an immune function failure. And there's been plenty of studies that have come out with that. And I know even some of the Kaiser oncologists use it. And of course, Kaiser, you know, is pretty conservative about what they'll allow their practitioners to do. I consulted once with a UCSF integrative oncologist. I had a niece with metastatic carcinoid. And I had put her on LDN, and her tumor markers were going up, up, up. She was followed at MD Anderson in Houston, and they just were watching her die. So, you know, I started working with her, and, you know, we changed diet, did nutrients, put her on the LDN, and tumor markers started going down, down, down. So then I consulted with this doctor to see what else could I be doing for her. And he told me, "Oh, I'm so glad you have her on LDN. I recommend that for all my cancer patients." So,
wow.
So yeah, I just think it should be on the radar with cancer for sure.
Why isn't it? Why isn't it just that's just part of it, period? Once you are diagnosed, you start that immediately. That, in my opinion, that should be the protocol for that.
Exactly. It should be standard.
Yeah. So, okay. So this is kind of an off the cuff kind of thing that I heard about people who are, that have a craving for alcohol, or who are alcoholics or borderline alcoholics or whatever, that function in daily life and whatever. I had heard about a protocol of naltrexone, not low dose naltrexone.
Yeah.
Okay. Where you take the naltrexone and then you wait. I thought I read an hour. This has been 2 or 3 years ago I read this. And then you have to drink after you take it, so that you don't feel the effects that the alcohol has on you. And the alcohol becomes less, somehow it becomes less of a, you know, like you're not getting the same effects. You're not getting
don't get the reward. Yeah. Yeah.
Have you heard of that protocol before?
Yeah. I've used it recently with one of my patients. So it's called the Sinclair method, or the Sinclair protocol.
That's what it was. Yes.
And I hadn't heard that okay, I can see what you're saying about, okay, you have to drink to say it doesn't really give you anything, but I never heard of using it that way, but I can see the utility if you want to decondition. But instead, like I have a young patient that, you know, when he drinks, he just can't stop, you know, and he does everything else in his life well, but, you know, whatever the mix is of that drug being his drug of choice. So he is using it, and usually it's, you know, 50 to 100 milligrams. You take it, you know, an hour before you go out. And he said, yes, he goes out and he'll have 1 drink or 2 drinks instead of 8 drinks, you know.
Yeah.
It's a way to drink judiciously and not go overboard with that. There's another thing I'll just put on your radar, but IV NAD can totally take away alcohol cravings and other drug cravings.
So IV with what is it? An N-acetyl what? What is the
it's NAD. It's vitamin B3.
Oh, D. Okay. Okay. Really?
No, it's B3. NAD. So not NAC, but NAD. And it's been used quite a bit in the last 10 years for addiction. But for alcohol, it's like super easy, you know, 1 or 2 IV treatments can stop people's cravings. One of my friends did it for her nicotine cravings. It immediately went away.
Really?
And it's another thing for immune inflammation that hopefully we'll be hearing more about. I'm super excited about using it with my neurodegenerative patients because basically it somehow it causes mitochondrial biogenesis. The mitochondria like just regenerate. And I mean, so it's used for anti-aging. It turns old mice into young mice.
Okay.
You know, so general anti-aging is a good thing. But after we hit 40, our mitochondria are on the downhill slide. But if we have any kind of immune disorders, chronic illness, our mitochondria are getting slammed. You know, so we do a lot with our nutrients of trying to help support the mitochondria. But this NAD can get them just jump started and going. So in the world of addictions, especially, that's been pretty useful.
Okay, very cool. Someone's asking me to put it in the chat about what you just said. Well, I'm not going to type the whole thing out, but do you have a website or a resource that people can look up more about this?
Well, for the NAD, Springfield Wellness is one of the premier places that's been doing it the longest for addictions. And I actually just went out there and shadowed for a week and had some interchanges. And if you just type in IV space NAD, you'll see lots of stuff come up. This past year, there was articles in Scientific American and Time about the anti-aging kind of effects. But yeah, it's going to be it's an exciting thing on my radar.
Very cool. Very cool. Okay. Last question we've got, and then we're going to wrap up. Anushka's asking, breast cancer, what is the combination of the LDN and what's the rest of the question?
Lipoic acid. Yeah.
Oh, okay. Okay.
Yeah. So this doctor used IV alpha lipoic acid. The oncologist I consulted with at UCSF told me that he thought that high dose oral would work just as well. So with my niece, I put her on R-lipoic acid. So the alpha lipoic acid turns into the R-lipoic. So that's the more potent form. And I can't remember exactly the dosing, but you know, I probably went 2 or 3 times higher than the standard dosing with that.
Okay.
So yeah, you could just use high dose of oral.
Okay. I think we're going to have you come back and talk about Alzheimer's. You're fascinating.
Yeah. No, that would be great.
Okay. I mean, seriously, I know that, this is going to get people stirred up anyway, because every time I've done a live or talked about LDN over the past couple of years to my coaches, they're like, what is that? What are you talking about? And I'm like, all right, we need to find someone. So, lots of conversations going around about the brain and brain health and the Amen Clinic and all of that. But I want to bring you back and let's do the Alzheimer's conversation. I think it's super important. It's in my family. I know that a lot of people out there are dealing with aging parents. So I will have my team get with you and we will bring you back and we'll have a conversation about dementia and Alzheimer's, if that's all right with you.
Oh, that's my passion for sure. Wait, I just got to say 2 things that were on my list to cover.
Yes.
Fertility. LDN's been used for fertility. And it's really powerful. There's a doctor in Ireland that presents at the LDN conference. And they said women who kept having miscarriages, they said, maybe there's something immune going on. Let's try LDN. So they would try that. And then first they were using it for people who couldn't conceive. And then they'd conceive. And so then they say, okay, great, they're conceived, let's stop it. And they'd miscarry. So finally they came to terms with, maybe we better just continue this. And then when they continued it, the women would be able to carry the babies to term. And they followed the children out for at least 6 years, is the last I heard, and did not find any implications for any damage to the baby. But so fertility is an interesting notion because so many people suffer with that. Restless leg syndrome. It's been helpful for restless leg syndrome as well. And then for the pets, there's a site on the Facebook, LDN Love Our Pets. And it's weight-based dosing for the pets, and some vets are using it. And I did prescribe it for I was staying with someone, and they had an 18-year-old cat that was so arthritic, and it was terrible. you know, and they weren't ready to let her go. And they told me it was really helpful for her pain that she was able to walk around. So, you know,
Really?
it works for the pets as well.
Okay. Where would my vet is one of my best friends, and she's wide open to holistic treatments and different ideas. She actually, it used to be one of my clients, and I still work with her.
Yeah.
She takes LDN for her ulcerative colitis.
Yeah.
Her doctor, in fact, let me say this too. I forgot to tell this part. When I started working with her, we did all of the 7 essentials with her health. We got her into remission. And I said, you know, the last piece of this I really want you to look into is looking into see if you can find anyone that will prescribe LDN for you. Well, she's under, you know, she was under a Vanderbilt doctor up in Nashville because they almost dissected her. She was in the hospital with serious ulcerative colitis. And they said, you've got like literally 1 month we're going to give you to get this under control, or you're, you know, you're back. Yeah. So when she started, she got someone to prescribe the LDN. She was like, I don't know anything about this. It looks pretty harmless from what I've read. Okay. So she got the prescription, started taking it. Clear colonoscopies 2 years in a row. And the doctor said, whatever you're doing, just keep doing it, you know? And she, you know, she said, well, I really think the LDN has been super powerful. She took a break from the from the LDN recently and had and ended up having a flare up of ulcerative colitis recently because she was under significant stress. Yeah. I don't know if that's correlated. It's possible, but just the fact that she's been in remission for so many years, and that's been a supportive, part of her journey, I think is really important to note. Yeah. So if we're going to use it for back to the pet thing, if I'm going to ask her to prescribe it for my 15-year-old little Basset that's struggling to get up the stairs a little bit, where would she get that done? Where can you order that? Would you order it from my compounding? Yeah, the same. Like I've gotten it from Belmar. Though now Belmar tells me, you know what, we have a new rule. We'll only take it for pets from the vet. So I can't prescribe it myself for the pets right now, but your vet could, and they know the dosing. It is a weight-based dosing. Awesome. You know, and you just get a little tiny thing. It's easy to put a little pet food around it and pop it in their mouth kind of thing. So and that's the benefit of Belmar. Those little, you know, tablets would be easier than the capsules it skips. Okay, I'm going to ask. Skips does it too. I mean, Skip, he was the first pharmacist, you know, working with, he knows so much. He's a great resource. And, you know, that's down in Florida. But they all ship all over these days as well. So, it should get on your vet's radar because, I mean, I watched, you know, they had the truth about cancer, but there was a truth about pet cancer. And they said basically almost 100% of our pets are going to die of cancer now. I know. It's awful. It's, you know. It's a whole nother topic, but yes, so LDN definitely for our beloved pets. Okay. I'm going to talk to my compounding pharmacy here. She's amazing. And anytime I've asked for anything, you know, she's like, sure, we'll do that or whatever. I'm going to talk to her about getting the tablets in and then see if she could be a resource for me. Cause I know she ships all over the country for medications too. Great. So awesome. Great. You've been a wealth of information today. And I just want to thank you so much for your time and all of this knowledge and really bringing this. I think we're probably the first people to bring this to health coaches in a bigger way than just tossing it out there to look into it. And it's super important that we stay on top of this. So anytime there's any brand new information, I would love for you to just reach out to me and we'll bring you back for that as well. But I will definitely get my team in touch with you and we're going to get you on for Alzheimer's and dementia. And we'll get you on the calendar and we'll talk to you again really soon. Okay, wonderful. Yes, thank you so much. Thanks everyone for joining us. We appreciate it. Have a great rest of the day. Thanks.